Women's Health Wednesday now. We know every second counts when someone suffers a stroke. And while stroke is a major concern for women and men, women tend to have worse outcomes and more women die of stroke. They also have some unique risk factors. So let's get some insight on all of this for women and men. Dr. Colin Hurst of Albany Associates in Cardiology joins me now. Dr. Hurst, thanks for coming in.
Thanks so much for having me.
Of course. I know this is something that you are very much in tune to. And we know that stroke is basically a brain attack, but give us a little bit more information and what people should understand about stroke.
You know, the basic pathology with stroke is that it's just a lack of oxygen to the brain tissue, and that can come in two forms, whether there's a bleed inside of the brain, or more commonly, it's because of a lack of blood flow. And that has to do with atherosclerosis, or hardening of the arteries. And that is a total body type of pathology. It can happen in the brain, it can happen in the heart circulation, in the renal vascular circulation. And so stroke can end up leading with certain mortality and morbidity, especially for women.
Yes. So let's talk more about that. There are some unique risk factors, but do we know why women tend to have worse outcomes?
Well, in many industrial countries, including the United States, a stroke for women is the third leading cause of death, as well as disability. And additionally, it leads to longer hospital stays and greater disability among women for those patients who have suffered from stroke. In terms of risk factors that are unique to women, there's a couple of different unique scenarios. Hormonal changes, for instance, pregnancy or oral contraceptive use, as well as autoimmune diseases, which tend to be more prevalent among women.
Yes.
And additionally, migraine with aura, which also happens to be a little bit more common among women. And those patients that also have those types of headaches and that also use oral contraceptives or smoking potentially increase the risk of stroke.
The combination of
Yes,
those.
the combination. So there are certain medical factors that particular to women that increase the risk of stroke.
I see. Non-traditional symptoms. We'll talk about the acronym in just a moment, but what are some of the non-traditional things that women should be aware of?
Yes, and not only stroke, but also in heart attack and other types of cardiovascular issues. There are sort of these non-traditional strict risk factors, or even non-traditional signs that women tend to have. And so sometimes confusion, lethargy, generalized weakness, parts of speech that would otherwise signal a stroke, but also may be confused as general malaise, for instance, that may be passed off as non-specific symptoms for a number of different maladies, may be dismissed.
Right, pay attention to it.
But correct, right, sort of paying attention to some of these more non-traditional. But certainly, you had mentioned the acronym, but I think it's really important, right? So face, arms, speech, and time. So do we notice that somebody has facial drooping, potentially one arm versus the other, weakness, numbness, paralysis in one of the limbs? Speech, is the speech mumbled, garbled, or not making sense, can't find words appropriately? And then time, it's certainly of the essence. And whenever you see a combination of these symptoms, seeking medical attention immediately is going to help improve outcomes on the back end.
Yeah, you can't wait. And it's okay if you're wrong and it's not what you think it is, just make that call.
And it's better to be safe than sorry. If a lot of these non-traditional signs and symptoms do have a cause of concern, I always tell patients, you've been living with your body your entire life, and if something doesn't feel right, please seek medical attention. It's better to be safe than sorry in those instances.
Act on it, right? Real quick, the Watchman is something you've been working real hard on with a number of patients. You've hit a milestone. Tell me about that. It's a preventative treatment for stroke.
So atrial fibrillation is one of the leading causes of stroke, thromboembolism, for patients that have this type of cardiac issue. We do give patients medications that thin out the blood in order to help prevent stroke. But for patients that are not candidates to be on long-term medication that thins out blood because they've either had a prior bleeding issue or that they are at risk for a bleeding issue, we have an alternative therapy. This is a catheter-based therapy that helps to plug up this area in the heart, which is implicated in 90% of all stroke related to atrial fibrillation. And our wonderful institution has reached a milestone. We were able to implant the 400th Watchman device just recently. Myself and two partners, Dr. Robert Fang and Dr. Alfonso Prieto, are both part of the program. So it's with great humility that I'm able to say that our program has reached this milestone.
Fantastic. Thank you so much for coming and talking about this
Well, thank you for having me.
Yes. And of course, for all of our resources and to find all of our Women's Health Wednesday segments online, you can go to news10.com. We'll be right back.